The American Academy of Pediatrics says more than 14 million children and teens live with obesity. They're at a higher risk for many health problems, including asthma, sleep apnea, type 2 diabetes, and heart disease, according to the CDC. Now there are new obesity treatment guidelines for teens and children. To talk more about this, I am joined by Dr. Franchelle Hamilton, a board-certified bariatric surgeon and weight loss expert. Thank you so much for taking the time to talk with us today.
Thank you so much for having me.
Can you walk us through the updated obesity treatment guidelines for children and teens?
Yes, I'd love to. So let me start by going back over what it used to be. So prior to these new guidelines, we didn't really have any main treatment algorithms for people who were obese or even severely obese, which is what we're getting to now in our children and adolescents. And so typically between the ages of 6 and under, it's just kind of watch and see, make sure they're eating fruits and vegetables, make sure they're getting their exercise. And then by 12, it was kind of the same thing. Maybe we'll have them see a nutritionist. And then typically it wasn't until they were in their teenage years and they were still struggling with obesity on the growth chart that at that point we recommended certain medications and then maybe even surgery. The new guidelines that came out is getting rid of the watchful waiting that we often did in previous years or for decades before now, because we're finding out that when we start seeing it, especially 6 and older, watchful waiting is not going to be the way to go and we are starting to see more medical problems by age 10 through 19 in this age group. So they're starting to develop high cholesterol, diabetes, sleep apnea, all these things as early even as 6, but a lot of incidents between the ages of 10 and 19. So now, usually 2 and under, it's the typical potential baby weight. Once kids grow older and start moving around, we're still doing a lot of watchful waiting, obviously in that age group. From 2 to 5 and 6, depending on several other factors that now the primary and the pediatrician are looking into, we may start doing more interventional or what's called intensive behavioral lifestyle therapy in that age group. But that's still kind of a gray area and it depends on other factors. Starting at age 6, if their growth curves continue to be on the obesity, and they have been now for several years, we're recommending intensive lifestyle behavior therapy, very much what we used to do for adults that are seeing this. And we're talking about including not just the pediatrician, but we're talking about getting a nutritionist, we're social work, counseling, and then they're actually on a weekly program. And obviously the family is involved, right? It's the pediatric centered, but the family is also very involved, and they're having to do these 3 to 12 month programs starting at the age of 6. We're recommending at age 12 starting medication. A lot of medications that were previously just prescribed to adults are now being approved for kids starting at age 12. So that's new. And then at age 13, we're even recommending surgery at this point if their growth curve has consistently been in the obese range. And these changes are significantly different than the way we've been treating childhood obesity for the past 100+ years.
What are some helpful tips for families when it comes to managing obesity?
Yeah, so it definitely needs to be a family-centered thing. I always call it generational health. So a lot of times, especially with children, parents play a large role in what they're eating. So get kids involved in their nutrition, educate them about nutrition. They're not too young, especially when they start school, to start learning about fruits and vegetables and how it can make them healthy and strong. Get them involved in gardening so they can kind of help learn more about that. Play with them, physical activity, decreasing the screen time is obviously a must. And then once they start getting into consistent higher obesity numbers, we talk about motivational interviewing, where they're just engaged. We empower them, and we give them a lot of tools to help them make healthier choices. But it really has to be kind of a partnership between the family and the child, and they work together to become healthier together.
Dr. Hamilton, thank you so much for your time today and for your insight.
Thank you so much for having me. It's a pleasure.